purpose of this meeting is to receive and consider the 2019 annual report of St. Louis County Commission on Disabilities and discuss how disabled persons and the programs to assist them are being affected by COVID. Let's see, Diane, can you call the roll?
Yes, ma'am. Councilmember Dunaway.
Present.
Councilmember Clancy.
Present.
Councilmember Tracus.
Present.
Madam Chair, you have a quorum.
Thank you so much. This committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. Thank you all so much for being here, and thank you for your patience as we have worked through COVID. I'm so sorry that it's taken until December for you to be able to show up to present on the 2019 annual report. But with that, I am going to hand it over to you all for your presentation and discussion of how our community, our disabled community, is being impacted by the coronavirus.
Hi, I'm assuming you want me to speak since I'm the chair.
I think that would be great.
Okay, thank you. I apologize for all the messed up with the technology, but here we are. As far I know, at the last minute, it was requested how COVID has impacted our meeting. Carol Flood is our ADA coordinator, and she has set up WebEx meeting similar to this, and that's how we are conducting our meetings. We still have a difficulty in getting a quorum. You would think since you're home, you will have more people attend, but there's still an issue of reaching a quorum. And so there are some agencies that are impacted by COVID. I don't know if Sarah Cole or Sarah Schwieger from Paraquad is on, but they could address how that is impacted Paraquad. So as far as the commission meetings, we managed to have them by WebEx meeting, but if we have a project, that's been put on hold because it's difficulty to meet people. And because, for example, if we want to look at a physical space, we don't necessarily can get to that physical space. So that's how COVID is impacted our meeting. Shall I go ahead with the annual report, Councilperson Dunaway?
Yep, I think that would be great. Thanks.
Okay. All right. I think all of you have our report. And I'm going to say, as I mentioned earlier, Kara Flood is our ADA coordinator. And that is a big accomplishment. And I want to thank the council for voting for this. And she has been a big help to us, as well as I'm sure she's helpful to the county departments. And the other accomplishment, we took a look at the blueprints of the South County Police Precinct because we want to make sure that it's accessible to people with disabilities. And when we talk about accessibility, we're not only talking about physical accessibility, but communication accessibility, as well as accessibility for people who are visually impaired. We had a new addition to the commission, Linda Johnstone to the commission. We updated the transportation matrix so that people know they can find public transit or maybe other rider share programs that are able to take people with disabilities to their destination. And we've continued to work with the ADA coordinator to make sure that the county has things that are included with people with disabilities. So that is our accomplishment for 2019. We do have recommendations which are listed in the letter. The biggest recommendation is that we have a resolution for UD, Universal Design, and we would like the county council to sponsor a Universal Design audience to make it so that when there's dollars going into housing or public access, they incorporate Universal Design principles. And we would also like to know what the plan is for people with disabilities in institutions as well as non-institutions, and the rollout for the COVID vaccination. And we want to continue to strengthen our communication with the Older Adult Commission as well as the County Council Committee on Disability. That sums up my report. Thank you.
Okay, so does anyone on the committee have any questions?
Oh, go ahead, Councilman Tracus.
Thank you. Yes, I'd just like to hear more about the ADA coordinator, how that position is assisting the commission, but also the county in terms of assessing accessibility of various county facilities and buildings.
Well, I let Kara Flood address that, but the main thing we wanted to make sure is that she gets involved with the police training with people with disabilities, and I know she's been working on that. Kara, I'll let you speak on that.
Thank you. I always forget that. There's been a couple changes in terms of accessibility around the Clayton complex. And I don't know if that was 19. That might have been, yeah, no, it was 19. So there's been some changes we've installed some signage to direct people to accessible entrance for the county buildings. There's been some markings, some modifications done on our county dock. Those specifically have been related to some accessibility and safety issues. And then as Linda talked about, there were two, I facilitated a meeting with the architects that were working on the two police precincts, and was able to get two of the commissioners, Cheryl and Stan Brown, were able to attend a meeting and give their input to that. So I think overall, in terms of the county, I certainly have been very active in assisting managers, supervisors on how things are handled in terms of ADA related issues with county employees. I answer quite a bit of calls from the county, from just the general public, ADA related, make a lot of referrals to different community entities, different resources as it relates to ADA. I also have sat on the group that developed the new county website, and that was very a big point to make sure that the new website was accessible. I facilitated some training for the IT staff on accessible websites through some folks in Columbia. I certainly think that the requirements of ADA are much more present throughout county government, given my time in this position full time, although it's it's still been a relatively short period of time.
Okay. Two more questions. One is, can you update us on the status of bringing the council chamber into compliance with respect to accessibility for disabled folks, whether it's communicative or physical, in particular as it relates to being able to present to the council, give a statement to the council? That goes back probably to 2018. We discussed that.
Yeah, and I know I don't have a current update. I know there was some work done on the podium. Was that this time last year, I believe, to make the, where folks come in and give public comments. There was some work done there. I don't know the status of that. I continue to have conversations with Diane about addressing anyone's needs, anyone that needs an accommodation to participate in the meetings. I don't know that we've had a lot of requests for that, but I'm sorry, I would have got an update to where we were, at least with the podium. I haven't physically, I haven't been in Clayton for some time. Did I miss another question?
Well, before we get on to the last question I have, I want to stay with this one for a minute. So maybe you could circle back with us after you access some additional information with respect to that status of the chamber, because it, in my opinion anyway, is woefully deficient. The image of Stan Brown trying to present to the council is everlasting to me. And that's a problem that needs to be addressed. And then the last question I have for you is, how big is your staff, and do you have enough people to really address the county's needs from a compliance standpoint with respect to federal laws? ADA, the Rehab Act, et cetera.
I am the only staff person devoted to this. I work as closely as I can with the building staff, the public works folks, to try to get, address any needs that show up. But yeah, I mean, and get involvement with the commission on any new projects. But yeah, certainly, I mean, it's just me, so I do what I can.
Understand. I think that's all I have at this point, Madam Chair. Thank you.
Thank you, Councilman Tracus.
I have a few questions, Madam Chair.
Go ahead, thanks.
So kind of sticking with this theme of accessibility, Carol and Linda, either of you can answer this. Obviously we're not in the chambers right now. Many aspects of county government, including the council meetings, but also many ways in which information is delivered to citizens in St. Louis County during this age of COVID, has moved into a virtual format. And I know, Carol, you mentioned your work on the website. I also think that you had an opportunity to review some of the changes that the council made to public forum. I guess I'm just curious if you have any other feedback or critiques of what county government could be doing better, especially when it comes to disseminating information about COVID, resources, health and safety things, all of that, to make sure that folks in the disabled community are have access to this information and resources.
I like to address that. For example, your web ads platform does not have, unlike Google Meet, it does not have the ability to have caption. So if you've got a person who's like me, hard of hearing or deaf, they're going to need captions. So I don't know how you getting the publicity about that. I don't think it should change regardless of whether you sit in the chamber or sit in your room, because accommodation falls under ADA, and anybody should be able to call a number And if they want to attend a virtual meeting and they have a need for caption, somehow that information needs to get out there, you know, because people may say, well, they have virtual meetings. I don't know if I can attend. I have something to say. So I would like to see that you make sure, because we always talk about physical accessibility, but there's a lot of us who have trouble because of the communication access. And people who are blind, it might be a different format for them too. I can't address that, what they're running into, because Steve Chanel, who's a commission member, I don't think he's on this meeting, but he could address that. So I just want to say this, how you doing on your website, how you do it on TV. Like when county executive page is there, you always see the interpreter, you know, and I like to see the same thing happen when the county council meet. Now me, I'm not fluent in sign language, so I would need caption.
Got it. That's very helpful. Thank you. Yeah, I've never thought about having a sign language interpreter for county council, but it makes sense that that could be something that could help more folks access the council meetings. When you have a format where there's many people, like in the council meetings, which is different than with the county executive where it's just one person, is it enough to just have one interpreter, or do you need one interpreter for each person?
No, how it works is by the hour. For example, it's always a minimum of 2 hours. So if there's multiple people talking, like if you're speaking for 30 minutes, they usually can interpret for an hour. And then the second person comes on and takes over, and then they do the sign language. So you probably have two in a 2-hour meeting, but again, they will say, they will also give you, as you do introduce yourself, the interpreter is saying your name too. And so,
Okay.
exchange speaker, if it goes to Ms. Dunaway, then they need to say Ms. Dunaway speaking, and then
Okay.
go ahead.
Yeah, good feedback. Thank you for that. I guess my other question too is I would like to hear a little bit more about the universal design resolution that you all are thinking about. I think one of the very last meetings I went to before the world changed actually was with your commission earlier this year, where I heard you all talking about this this idea of working with the council on a proposal related to universal design. And I'm curious to hear a little bit more about where you are with that and what specifically you were asking the council to do by way of a resolution.
Well, we have a resolution. We just want to strengthen it to the next step. Audio.
Got it.
So where we are as a commission, we did a little bit of research on what other cities do. And there's not a whole lot out there because I don't know if Chicago has one, because we're looking for cities that are older, like St. Louis, because if they're doing rehab in a building, having universal design is different in a new building. Maybe Cheryl Rose could add something to that. Cheryl?
Yes. I would like to do that. In terms of the universal design ordinance, what I think that we talked to you about, Lisa, it's been some time, but I can't remember, is asking for the county to set up a committee to explore this, because I don't think we're ever going to be successful in getting buy-in unless we have builders and architects and people involved in the process. And I don't think that the Commission on Disabilities has the, what do I want to say? The, not the power, but, the ability to get those people together to talk about it. So I think that's one thing that we would like is to have the council use its influence or its power, or however you want to phrase that, to get some people together to explore that possibility and see what will be acceptable for St. Louis County, what will be useful for St. Louis County.
So it would be a group of different stakeholders who could help formulate some legislation that would help prioritize universal design in St. Louis County.
Right.
Yes.
And at a minimum, and this might be a precursor, something that could happen a little quicker than that, we would really like to see builders be required. I know that's a hard word in these days to say, but be required to offer universal design options. It doesn't mean that they have to do it or that the buyers have to take it, but a lot of people just don't know that that's an option. Builders will say, we'll do it if you ask for it, but a lot of people don't know to ask for it. But then when they see what the options are, the bigger bathrooms, the kitchens, the hallways, the this and the that, it's things that they want. And I don't know, I don't know, that might be just something that could happen before a universal design ordinance. It's not as onerous. And it's, it's just something that they can offer to people. So.
Great, thank you. That's the end of my questions for now, Councilwoman, Madam Chair.
Do any other council members have any questions?
I'm sorry, I do have another one.
Go ahead, Councilman Tracus.
Thank you. I'm just curious. I'd like to hear more from Linda about the commission and the lack of attendance or the inability to get a quorum. That seems to be a chronic problem. I know we discussed that before COVID when you folks were able to meet live. And I'm just disappointed that it seems to continue. Could you tell us more about that?
Well, we had 2 commission people that were inactive, and we finally got them off the roster. And we don't have any representation in North County, particularly people with disabilities or agency. We have some slots available. And I know there is 2 gentlemen who have applied, at least they told me they applied, but I don't know where it's at with the county executive office. And I suspect they are white males, and I would like to see more representation in North County. And among us, our membership, we've asked different people if they would like to join. And we had one individual, Stephanie McDowell. I don't know what happened to that application. So it's very hard to get people to join us. And I've been on the commission since Buzz Westfall, so I've been on it for a long time.
May I add something as well?
Please.
The way the commission, the ordinance that sets up the commission says that we have to have 15 members, or says that there are 15 members, and so a quorum is half of that number. but we don't have 15 people on the commission. And so that contributes to the inability to get a quorum. And there are several applications that have been submitted to the county executive's office going back to even before Steve Stenger, when he was executive, that haven't been acted on.
How many slots are vacant right now?
There's probably at least four.
Yeah, we tend to be poor. I'm trying to look for it.
Well, we'll look into that and maybe we can motivate some action on that. But thank you for filling us in on that. That's all I have, Madam Chair. Thank you.
You're welcome.
Thank you, Councilman Tracus.
I have some additional information. Is this appropriate time?
Yes, please.
You had asked your agenda that you sent out how people with disabilities are being affected by COVID. And I do have some information from some of our council members that wanted to respond to that. One of them, Steve Schnelly, who works for the Rehab Services for the Blind, says that, oops, I just lost him there. Getting back. Don't want to misquote him. He says that his clients are feeling isolated, that and they're having trouble getting the things that they need. Some delivery services, I guess, some of them use delivery services, but not everybody has that ability. Some people have computers, but a lot of people don't. So that's an issue. And I know that the aging committee is working with the libraries on some of those issues. Another real problem that people with disabilities are facing due to COVID is the fact that if they depend on caregivers and the caregivers get COVID, or members in their family get COVID and they have to be quarantined, that's causing a real problem. And most of the people who are caregivers are low paid. They take public transportation. They live in crowded conditions with other family members who are also low paid and take public transportation. And so the spread of COVID really affects them. Many of you know, or some of you know, I have a son with a disability who uses a wheelchair. I've had him at my house since mid-March because I can't, I'm worried about caregivers going in and either not being able to help him because they're sick or making him sick. I know that Stan Brown, who's one of our members, uses caregivers and has had some problems with caregivers being exposed and having to quarantine and not being available to help him. And
that means,
I don't want to get into the whole mask thing and all of that, but it is a real problem for people with disabilities who depend on caregivers.
And I'm just using Stan as an example. When he can't get a caregiver, he can't get out of bed. He is in bed. And so this is not good for someone like Stan, because that increases the chances of bed sores. Okay, that's all I had to add to that. I'm sure that there are many other effects on COVID that people with disabilities are having due to COVID, but those are the ones that I'm aware of.
Thank you. And Cheryl, that's partially my fault because I didn't ask for that until yesterday. So I apologize for the short notice in making the request. Are there any other questions from committee members or council members? Linda, Cheryl, Carol, anything else that you would like to add?
No. Just let us know what you need from us to make this universal design audience happen.
Okay, yeah,
Oh.
I still have the information you provided last year. We just couldn't get any. This year's been a little strange. We'll see.
Yeah. I do have one thing. I was going to bring this up at our next meeting, but since I have you here, I think we would like to know what the plans, I think Linda mentioned this, what the plans are for distributing the vaccine when it comes to people with disabilities, particularly homebound people who might not be able to get out. I know the health department is under a lot of stress, so I don't want to ask them to come to one of our meetings, but if you have any information on that, or there's a plan or something, it would be really, we'd appreciate your sharing that with us. And if there's anything we can do to help get that out or around, that would be great.
If I may, Madam Chair.
Yes, please.
Cheryl and Linda and Carol and everyone else that's involved with this commission, I actually would encourage you all to reach out to the health department directly and ask them to join you at one of their meetings. I appreciate the fact that you're being sensitive to their time, but they are really willing to engage with community members right now. I know that they have met with several constituent groups, including school boards in my district, to provide whatever data and other information they can. So I think that they would be really happy to hear from you and happy to join you at one of your meetings. So I would encourage you to do that. We do have a meeting with them on Friday. So the council will be doing a hearing with Dr. Garza and also with Spring Schmidt and Dr. Doucette from the health department. Councilwoman Dunaway will be leading that meeting because it will be in a committee that she chairs, but we can make sure that we ask them about vaccine distribution to this population. I don't know at this point how much they will know, but we can at least put that priority on their radar if they haven't put it there already.
Yes, thank you.
Thank you.
And I would like to add to that. I mean, you all said earlier that you don't feel that people with disabilities have a voice or the power to pull people into a room. And because you are speaking up for a lot of people who don't have that voice, I think it's really important that we all do everything we can to make sure that that stays at least in the minds of the people who are going to be making plans about vaccine distribution.
Thank you. And, Councilperson Track has asked about the vacancy. We do have, I forgot the gentleman's name, from the county executive office. He's going to speak to us in January. We don't meet in December, so at least we will be addressing again about the vacancy, and maybe we can get the health department to come in January. Well, you're rolling it out in December, aren't you? The vaccination?
Well, the planning for the vaccination is being handled at the state level. And though the county is certainly involved in those discussions, the planning is happening at the state level right now.
Okay, thank you.
Yeah.
Any other questions, comments from anyone? Diane, are there any, oh, you are, sorry, you moved. Are there any public comments?
No, ma'am. No public comments.
Okay, I believe that brings us to the end of our agenda. Does anyone want to make a motion to adjourn?
So moved.
Before we adjourn,
sorry.
I do think it's incumbent on this committee. I know we've had a very stressful year, but I would encourage us to convene as soon as possible after the new year and take a deeper dive into some of the questions that were raised today with respect to accessibility, whether it is electronic or physical, because we are missing the boat on a lot of fronts. There's no reason that the virtual council meeting should not have a window with an interpreter in it, and that's a really valid point. But there are others, and so I would encourage the chair to convene the committee as soon as possible in the new year and work with the commission to make them as more effective than they already are.
What he does is he'll lend
Noted. Thank you, Councilman Tracus.
future tax credits.
Okay, how about that motion to adjourn?
So moved.
Do I have a second?
And kind of arranges that kind of stuff.
Second.
All right, this meeting is
Even though there's
adjourned.
money.
Thank you all so much.
Thank you, ladies,
you,
very much.
everyone.
Thank you. Take care and be well, and happy holidays.